You're listening WMNF Tampa.
The opinions presented on the Healthy Steps show are the evidence-based opinions of Dr. Fred Harvey, the callers, and his guests. These are not the opinions of the staff, the volunteers, or the board of WMNF. The information provided on the show is not intended to diagnose or treat any disease. There is no implied patient-physician relationship in these calls. The nature of the calls is educational and informational only.
Good morning to you, my worthy friend and listener. Let me remind you that you are incredible, and thank you for keeping your radio dial tuned to WMNF Tampa, your resistance radio station from Tampa Bay to the Gulf of Mexico, and the only bodacious little FM station that they broadcast during the Messinian salinity crisis, and you can stream us as well at WMNF.org. Well, holy mackerel, will you look at that? It is Ask Me Anything Monday today. So listen up, my little buddies. I would like you to call in to the Healthy Steps radio show and share your medical questions, comments, and concerns. Just give us a call at 813-239-9663. That number again is 813-239-9663. You can also send an email to dj@wmnf.org. Good morning to you, Dr. Harvey. I hope that you had an awesome weekend and that you are saddled in to direct us through another AMA Monday. So let me scram post-haste and get out of your way. What is up ahead for the show today, Doctor?
Well, thank you for that intro, Bill. As usual, a wonderful Monday morning start. How are you today?
I'm doing very well. It's a great start, as you say. It's going to be a little hot, but did you have a wonderful Father's Day as well?
I did. I had a wonderful Father's Day weekend. I got to spend all Saturday afternoon, I should say, with a large swath of my family and friends celebrating a new baby to be coming. We had a baby shower for my nephew's firstborn coming in September. And then that was celebrating his new coming Father's Day. And then yesterday, I got to go to a really impressive property. My son does sustainable landscaping, and the family of Bertha Palmer. Bertha Palmer developed much of Sarasota County. She was a Chicago banker who basically developed Sarasota, and there's a 9-acre swath on North Casey Key the family still owns. They call it the jungle. It is pristine barrier island, basically unchanged except for a few houses that were put amongst the jungle. And he just is working on rehabbing it after Hurricane Milton. Some native plants need to go back in. It's what a beautiful property, and what a job being able to be out in this nature, recovering it with native Florida plants. It's just wonderful.
That sounds like a great weekend, wonderful experience, and a lot of love.
Yes, indeed. And so there's a lot of things going on, and a lot of really amazing things. I just keep reading more and more great information about how modern medical science is really helping us. And I know that many of you remember during the pandemic, we had lots of discussions on this show about the nature of vaccine, the nature of the COVID-19 genetic therapy, the mRNA vaccine, and how people have done with it. And originally there was some really interesting information that came out that made a lot of academic doctors look at what the shot was doing. And there were a bunch of people that were thinking that cardiovascular events might have been increased by the shots. And indeed, there's some evidence that there may have been something. But overall, COVID-19 infection is much worse for the body than a COVID-19 shot. And when people get it and they have comorbidities, in other words, they have other illnesses, they do much worse with the virus, or any virus. We know that people who get influenza, who are elderly and have medical problems, tend to do more poorly than people who are young with fewer medical problems. at the very end of the bell curve, the infants and the extreme elderly, they do very poorly because they just don't have enough resiliency as yet in their bodies. The old people have lost it, and the young people haven't developed it yet. And so the very interesting thing that I find coming out about vaccines is that they're changing all-cause mortality. All-cause mortality means every cause of death. And there's some evidence that one flu shot can reduce your risk of dementia, just one, over time. Changes the inflammation in your body, and you have less dementia. Well, and the reason is it's the inflammation. I talk all the time about how toxicity and inflammation go hand in hand to make things worse. Well, medical problems make you more toxic, and they usually increase your inflammation. The inflammation makes it more difficult to clear toxins, and it creates toxins of its own in the inflammatory molecules of the inflammatory process. And so we have evidence that if you have a systemic inflammatory event, that means a flu, a hip fracture, a heart attack after age 65, you have more than two of them, you have a 50% increased risk of dementia. So your whole body is affected by inflammation and toxicity. And COVID-19 is no different. It caused inflammation and toxicity. The shots themselves cause a tiny bit of inflammation. And then they set you up for different kinds of protection. And what's really fascinating is that last November, in the Journal of the American Medical Association, they published an article titled COVID-19 mRNA Vaccination and 4-Year All-Cause Mortality Among Adults Aged 18 to 59 Years in France. And they looked at something like 22.7 million vaccinated individuals and about 6 million unvaccinated. Vaccinated individuals had a 74% lower risk of death from severe COVID and no increased risk of all-cause mortality over a follow-up of about 4 years, 45 months. And when they looked at deeper data, they even showed that there was a 25% lower risk of all-cause mortality. And it was also similar to the numbers even when you exclude severe COVID-19 deaths. So eliminate all the COVID deaths and look at all the other deaths, and you have a 25% reduction in all these other deaths. People are having less inflammatory complications, it seems. So the shots may have actually, put inflammation in the background. It's a pretty effective way at reducing overall risk. And this is for folks 18 to 59, and then just this month, another published article in JAMA Internal Medicine, 2024 to 2025 COVID-19 vaccine and major adverse cardiovascular events among U.S. veterans. This is another huge study. 1,039,000 participants in the Veterans Affairs Department. They were looked at, and they had huge risk reductions. Now, this is a different set of people because these are retired vets. So we're looking at people over 50 generally. And so what they found is that there was no significant increase in people younger than 65 years old or between 65 and 75. But for people over 75, the shots really reduced risk by 75%. This is pretty impressive. And that's just with one shot. And so the overall risk reduction from these shots goes well beyond dying from COVID-19. It's fascinating how connected our bodies are to these inflammatory markers. It's really impressive, and the thing is, anybody who has multiple medical problems has even more benefit. So, it tends to be that people over 75 do tend to accrue more medical issues, and so they really benefit from these shots. The studies are coming out now, and there are some really good reasons to vaccinate yourself. And I think it's worth discussing, and we can discuss that here on the Healthy Steps radio show. I'm Dr. Fred Harvey.
Indeed, we can discuss it, and I've got David, Truly, and Dana that want to discuss something with us, but I've still got a few spaces in the box, so I'm inviting you to give us a call to the Healthy Steps radio show with Dr. Fred Harvey here on WMNF Tampa. I've got Maddie in the control room answering the phones, and I'm very appreciative for that, so give us a call at 813-239-9663. Again, that number is 813-239-9663, or continue to send your emails to dj@wmnf.org. Good morning, David. How are you today?
I'm good. Dr. Fred, I've talked with you before about Ashitaba, and I just wanted to run something by you here. I've been walking from my house down the street to 60 yards exactly. We take about 2 houses down. And I turn around and come back. So that's 120 yards. And I'm walking it every hour from 8 in the morning till 8 at night, which gives me 13 times down and back. And then I walk 2 in between in the half hour, just 2. That gives me 15 times. I walked 120 yards. And it's a total of 1 mile and 40 yards. Is it better the way I'm doing it, or is it better to walk a mile at one time?
And how much do you break that mile up into?
Every hour.
So you walk a mile every hour?
I walk every hour. I sit in my driveway all day in my garage. Reclining.
So how long do you walk each hour?
Geez, I never timed how long it takes me to walk.
No, I mean, how many feet, how many inches, how many yards, how many meters do you walk?
I'm walking 60 yards down and back. That's 120 yards at one clip.
Okay, so that's a nice walk. It's, from what I gather, it's better to do it continuously to get the continuous circulatory flow going. But if you're doing it frequently, you're walking every hour, that's a really good thing. I mean, there's benefits both ways. So, yeah, I would consider trying to do that trip, do 240 yards instead of just 120. Spend a little bit more time out there.
Yeah.
But don't do it at midday in Florida.
Okay, but as far as the physical exercise, it seems to me if I walk at one time a whole mile and come back, I'm hot, I'm sweaty, I'm tired. I don't feel like doing it again the next day sometimes. So I'm doing this every hour for 19 days. This is
Excellent.
19 days.
Very good.
I from 258 to 226 yesterday in 19 days.
Beautiful.
I need
That's excellent.
pieces of fish or raw or rare meat. I don't eat any crap with it. I have fruit. I'll have an apple, a pear, and cut my eating and doing that walking. And I think it's working for me because I don't want to walk a whole hour out in the sun, you know.
Yeah, you want to do it before 10 and after 4 if you're going to be doing that.
Yeah, so I'm just going to do it every hour. It's working for me. Dr. Fred, it's great to talk to you. I appreciate you listening to me.
Thanks. And you mentioned that you had talked about ashitaba before, that Japanese herb?
Yes. I've been eating that for 6 years.
Interesting. Japanese people have been eating it for a long time, and they say it does a lot of things. Like they say with most magical herbs, they do a lot of things, but there's not a lot of clinical evidence. And there's something to consider that it does interact with medications in the liver through the cytochrome 1A1 and 1A2 systems. And so there may be changes in your metabolism of certain drugs. So,
yeah, let me tell you real quick about that. My doctor said, whatever you're doing, keep doing. I told him about Ashitaba. He says, the American Medical Association won't even look at this or something like that, he said to me.
Well, no, the American Medical Association won't, but many other people do. And so WebMD has stuff on it. Other herbal search engines do. And there's lots of data on it. And so if, I look at using herbs and treating yourself with herbs the same way as looking at yourself and saying, I'm going to go to Mexico and buy antibiotics because I can get them there. I can't get them here. Self-treating is sometimes dangerous, but if you're feeling good, I agree with your doctor.
Let me tell you real quick what I've learned by taking this for about 6 years now, every day. I juice it, mix it with a little grape juice, feel the flavor, it's delicious. I have your saliva becomes thicker, creamier somehow. And you can get everything out of your lungs, your head. I have no sinuses problems. I've never caught a cold or the COVID.
Well, that's an interesting concept, but I don't know that herb has anything to do with that.
I know.
Neither
I don't
do you.
understand, but that's what it does for you. It's amazing.
Yeah, lots of things are amazing. Meditation's amazing. Breath work is amazing. Doing breath work actually reduces your risk of getting severe COVID.
I do everything you say. I listen to you every Monday.
Fabulous. Great talking with you, David. Have a great day.
Yeah,
thanks for
nice
the call.
You. Thank you. Bye-bye.
Thank you, David,
Bye-bye.
and thanks for staying in touch with us. Let's go to Truly in Waiamama. Good morning to you, Truly.
Good morning.
Hi there.
My question is about a bone density test. I'm 67. I'm in pretty good shape and quite active. But my primary care physician keeps pushing to get the DEXA test.
Okay, and is there a reason you don't want to get a DEXA test?
Yes, the reason I don't want to is because she tends to be pretty quick to prescribe pharmaceuticals as opposed to more preventative things. And when I speak with my holistic, like my chiropractic holistic doctor, he says don't even bother with the DEXA because you don't want to take all of those nasty sounding side effect things.
Wow, that sounds like a really bizarre way of thinking about life. Why would you want to remain ignorant because a doctor might prescribe something? Why not just find out what it is? And then if you do have a problem, then you know you have more reasons to find more natural approaches to fix the problem, and you can ignore whatever your doctor says when they say they want you to take a prescription and do what you want to do. But I mean, is there, give me a valid reason to stay ignorant about your health.
Oh. Well, that's actually what the doctor says. Why don't you just go ahead and take the test and find out where you are? Well,
right. That's called preventive assessment or early diagnosis. I mean, if you have the problem, treat it, and then maybe if you do have some thinning of the bone, you might ask your doctor to order a urine test called a N-telopeptide. That's N-telopeptide. That looks at how much collagen you're losing in your urine. And if you're losing collagen in your urine, it means it's coming from your bones because the other type 1 collagen that you've got is in your hair, skin, and nails. And all of those things slough to the outside so they don't show up in your urine. So if you have high N-telopeptide, you're losing bone. And then they can also do a blood test called a PINP, a N-terminal pro-collagen peptide. This looks at how fast your body's making replacement type 1 collagen. I use those two parameters to help my patients understand their bone physiologic function to see if they're actively building or tearing down bone. Most doctors don't do it because they don't do function, they do disease.
So, well, I mean, the other reason to not do it is because of cost. It's not free.
No, but $150 isn't too bad to figure out what's going on with your bones.
Okay.
And Medicare pays for it, and most insurance pays for it. So if you don't have those, then your cash price is probably under $200, but your insurance price is probably whatever they'll cover.
Okay. And then, so if my physician is quick to just write a prescription for something with all those scary side effects, then I suggest the blood test and the urine test and so forth.
I would consider that. I would actually ask for those when the doctor orders the bone test.
Aha. Okay.
And then you can talk about it all at once, and then you can actually consult with somebody who's rational about those things.
Okay, and when I ask her for the urine test and the blood test, since I'm not remembering the things that you just rattled off, will she know what I'm talking about?
She'll have no clue, but you can listen to the archive. I spelled it out, PINP and N-TX. Those are the abbreviations. And most family doctors and internists should be doing this test to assess your bone function.
Okay. Okay.
It's what the drug companies use to monitor how well the drugs that they made up for this are working in between the DEXA scans, which you have to wait 1 to 2 years to see actual changes in the bone.
Okay. Well,
These tests are great.
That's been very helpful. Thank you very much.
You're so welcome.
Bye-bye.
Bye-bye. Have a good day.
Thank you very much there. And then I've got Dana in Plant City. Good morning, Dana. How are you today?
I'm good. I don't know if my radio's off. I tried to turn it off, but I'm in the car.
You sound good.
So I'm not driving, though. I'm reading a book called Invincible. It's a new book that just came out by a medical doctor, Frances Comite. I don't know if you're familiar with her.
I'm not.
I think she's out of New York. But she talks a lot about giving women low-dose testosterone cream as they age to help slow down a lot of the effects of aging. And she also, if men test low on their free testosterone, not their total testosterone, she'll also prescribe that in whatever dosage. And I didn't know if you had any knowledge of that, because we were going to ask our doctors next time we go. We don't know if they're just looking at our total testosterone when they do the lab work, or if they're looking at, because she said most doctors don't look at the free testosterone, and that's more important. So I wondered what your opinion was of that, if any.
Well, I think that I started looking into the anti-aging community back in the early 2000s, 2003, 2004, concurrent with my functional medicine education. And though I do believe that hormone balance and hormone replacement therapy is an important part of maintaining function, I think that to simply put someone on exogenous hormones when they actually have a body that's creating the hormones, though they may not be in the optimal place, then from my perspective in functional medicine, that individual deserves a functional workup to find out why the body is maybe not making optimal levels of these chemicals. And so that would, for me, entail doing my flagship screening test called the Nutra-Eval. It's a metabolomic test that looks at organic acids, amino acids, essential fatty acids, toxins, toxin processing, the whole ability of the body to deal with its daily work. And then also a urine hormone assessment. It's called the HUMAP, HUMAP, and it looks at a very deep and broad family tree of all the hormones. It looks at how the hormones are connected, but also looks at how they're excreted. And so that also affects your physiology. So, you know, a simple example of having low free testosterone could be, and I'm not saying this is your husband, this is an example that I have seen, a man who drinks a couple of ounces of alcohol a day and is a bit sedentary and has a little bit of a belly, ends up having an increased conversion of testosterone to estrogen in the belly fat because of the nature of the tissue. And so they shunt some of their testosterone production away to estrogen, because when you break one side chain off of testosterone, and a hydroxyl group it's called, you end up with estradiol, the principal female hormone. Break a rib off of Adam and you've got Eve. Right there in chemistry. How the ancients knew this, I don't know. But when you do this, you reduce the available testosterone. When you increase estrogen, you increase binding globulin, protein that holds on to hormones. And so you will naturally, by simply behavior and lifestyle, result in a lower free testosterone with a relatively increased estrogen and lower total testosterone maybe, without actually being ill or requiring hormone replacement therapy.
Okay, so in the case of someone with Parkinson's who is very sedentary, then it would be possible that he's got a higher estrogen versus the free testosterone.
Yes, and if nobody's looked at the whole panel, it's worth it to do that. And it's also worth it to look at how the adrenals are working. The HUMAP looks at the adrenals too, because in stress situations, cortisol production trumps sex hormone production, because when you're under stress, we don't reproduce. So testosterone and estrogen will go down, primarily testosterone, when you have high utilization of cortisol. DHEA turns into both estrogen and testosterone, but when you're stressed, it goes directly to cortisol, and you don't have that reservoir hormone. I find that women who have menopause and slightly low normal range testosterone, giving them DHEA and progesterone tends to fill up the basket, so to speak, and the machinery then can make more estrogen and more testosterone. And the person gets more flush with low-level upstream hormones that aren't as potent and or toxic as estrogen and testosterone. I take hormone replacement seriously, and I do it stepwise because I don't like toxic humans.
Okay. So we should... I am on estrogen replacement. I have been since I was like 27 years old. So in my case, it would be worth asking. Yeah, and I've done fine. So, I mean, I guess some women don't do as well, but I've done fine. But so what was that first thing you said? You said progesterone, but what was the first thing? DS8?
Well, what I would suggest is that you get a full hormone panel, like a HUMAP test, a urine hormone test, and possibly an evaluation of your fatty acids. An omega index can tell you if you have the right fatty acids to be making your hormones. You get a cholesterol test to make sure you have enough cholesterol to make your hormones. All this stuff is important in a functional medicine workup. We don't want to just dive into grabbing some DHEA randomly and hoping it works.
Oh, DHEA. Okay. Okay, well, thank you very much. I appreciate it.
You're very welcome, and I hope you get some good success with that.
Thanks. Bye.
Thank you very much there, Dana. And let's go to Eric. Good morning, Eric.
Good morning. I have a question. I had a recent scan of my heart done, and I came up with a 355 cardiac calcium score. So I wanted to get your thoughts on that and what I can do about it.
How old are you?
66.
And do you have any cholesterol issues?
Well, it's elevated. It's around, my HDL's like 70, 75. My LDL's like 130. My overall's about 230.
Okay, so yeah, somewhat elevated. And how about your high sensitive C-reactive protein?
It's always been in the normal range, which is great.
Good. And how about other cholesterol issues like your particle numbers and your particle sizes and your LP(a)?
No, that I don't know, to be honest with you. I don't know about that. I can get that done, I'm sure.
Yes, that'd be good. And then you have so you have a 355 coronary artery calcium score. Do you have any symptoms? Chest pain, shortness of breath, palpitations, anything like that?
Oh, no, I try to live very healthy. When it's not as hot as it is now, I run my dog 20, 30 minutes a day, and, I eat vegetables with no butter. I eat very, very little beef, never eat pork, eat baked chicken, don't have fried
good
to speak of. I mean, I have fruit for lunch, cantaloupe, blueberries, mangoes. My weakness is I drink a lot of 1% milk and cookies at night. I do have to say I do that.
So how many cookies do you eat at night? That could be a problem.
Well, it just depends. I've just given them up recently. But I used to eat quite a few, but probably 5 or 6 cookies and 3 or 4 glasses of milk. So I guess that's part of it.
Wow, that's a lot of milk. How about during the rest of the day? Are you getting 6, 7 servings of vegetables?
Yeah, I would say that, yeah, because we...
And how about fiber? Like oats and other kinds of fiber?
Well, I eat a lot of fruit. I have 2 or 3 mangoes for lunch every day. I eat a lot of...
About more... yeah, mangoes are great. They have soluble fiber. But there are some good studies about, grains, like oats specifically, reducing your cholesterol.
Oatmeal, yeah.
Yes, oatmeal's a great food for doing that.
Well, I can do that. I can have that maybe at night. I eat. See, I have to have a little something sweet after I eat dinner. I hate to say that, but I do. But I take red yeast rice, red rice yeast, 1,200 milligrams every day.
Okay, so it does a little bit. It's like a 4 milligram statin, like the old Mevacor. Really pretty not potent, but the issue is if you still have a cholesterol of 230 with an LDL of 130 on the red yeast, it's not working. And so I think that you deserve a broader lipid workup. Have your insulin sensitivity checked. Definitely waist circumference. Get all the parameters that would push you towards high cholesterol looked at, and work on those. But if you have a coronary artery calcium score of 355, it means you have some plaque in your arteries. And with no symptoms, it's really hard to tell what that actually means. Like, how much is your risk? They're stratifying it. But I think the biggest thing we see here is you have coronary artery disease and you have an LDL cholesterol that's over 100. And so those two things are not consistent with ongoing health. So you need to get your LDL cholesterol down to 80 or less. In whatever way you do it, whether it's just going and getting a statin, which works very well, or doing more stuff in your diet and exercise, increasing some of the vigorous nature and things like that, you might find that it improves. Also, improving your heart health to maintain your omega-3 status, getting an omega check from Quest, along with an advanced lipids panel, which includes the particle size, numbers, and the LP(a), so you get a broader picture of it. And you can also get something called the Cleveland Heart Labs test at Quest. Cleveland Heart Labs looks at whether you have rancid plaque, rancid fat, aggressive inflammation in the plaque that leads to these problems. It's a great test that I stratify risk for my clients with.
Okay. Yeah, I'll do that. I go see Dr. Erica Bradshaw. I'll ask her about that today, all those things.
Oh, excellent. Wow. She's, I'm sure, very open-minded and will give you some good guidance here.
Yeah, that'd be good. And I'll do that right away. And I only weigh 158 pounds, so I try to keep my weight down.
Oh, yeah. So I don't think you're dealing too much with insulin resistance. And so it's probably some genetic driver. And, you might just respond to a bowl of oatmeal a day. It drops cholesterol about 10%.
Wow. I'd love that. I can eat that instead of cookies and milk. Believe me, I love oatmeal.
Yeah, make oatmeal cookies and use allulose, allulose, sugar instead of regular sugar. They'll be a little less sweet, but allulose acts like a GLP-1 agonist and reduces inflammation in your body. It acts like Ozempic, so it helps to stabilize your metabolism.
Okay. Yeah. Luckily, my glucose is always around 70, and my triglycerides are like 75, so I don't have any of that.
Wonderful.
Yeah. Okay. Well, I'll do that. I'll check with her. I'll have an appointment with her today and ask her about all those things: the Cleveland Heart test, the advanced lipid profile. I'll do it. Thank you.
Say hello from me. I haven't seen her since the Zymogen conference years ago.
I will. I'll tell her I talked to you. That'd be great.
Wonderful. Have a great day, and good luck with this.
Thank you so kindly. Bye.
Thank you very much there, Eric. And now, my friends, it's down to about the last 20 minutes of the show, and I've got Roselle, who called all the way on in from Ohio, so I know that you can participate in the Healthy Steps radio show with Dr. Fred Harvey as well. Just express your medical questions or concerns by giving us a call at 813-239-9663. As I say, I've got Maddie in here today to help me. So the number, once again, is 813-239-9663. Good morning, Roselle.
Hi. I've got a question. I was told that I have a condition, hypothyroidism, and I saw something about that the condition is linked to low calcium levels. and I use an app to try to track my nutrients, and the app has been telling me that my calcium levels are too low. So my question for you is there any like natural herb, natural plant, natural flower that has been clinically proven to increase calcium levels?
Well, that's an interesting two-pronged question. First, we're conflating hypothyroidism with calcium levels, and that doesn't pan out in my understanding of thyroid metabolism. Iodine is more closely related to thyroid function. And so would you prefer that I talk about your thyroid health since you have hypothyroidism, or a sidetrack on calcium, which isn't related?
The thyroid health.
Yes, good. Okay. So thyroid health requires a couple of things. The thyroid hormone is an amino acid with 3 or 4 iodines attached to it. It's called tyrosine. And tetraiodotyrosine is synthroid, levothyroxine, or T4, the main thyroid hormone. T3, which is triiodo, that loses one of the iodines, very similar molecule, but it's the one that is active. It's the one that goes into the nucleus of the cell and turns on all the metabolic machinery. The T4 does not. It's a reserve. So when you are prescribed the synthroid or levothyroxine tablet, you convert that in your body to T3 in the amounts that you need it. If you're overdosed on that, we can look at another thing called reverse T3. It's the iodine's been removed in the opposite side from where the active chemical is, and it deactivates it. So reverse T3 is a non-functional molecule, and it goes really high when you're overdosed on thyroid. So we can see this stuff in your broad thyroid panel. If someone has just diagnosed you with hypothyroidism, they've probably looked at a pituitary hormone, not a thyroid hormone, a pituitary hormone called thyroid stimulating hormone, TSH. So did someone check your TSH?
Yes. My doctor had told me that she had wanted to put me on what is it called,
levothyroxine.
Yes, and
so what was your TSH level?
I think it was like five. It
Five?
was like one digit above where it should be.
Okay, so with that number being so slightly elevated, university, high-level endocrinologists have the opinion that that may be background noise, that you may really not have hypothyroidism, and most people between 5 and 10 don't necessarily need treated immediately. What is suggested is some watchful waiting. The problem is general medicine endocrinologists twiddle their thumbs while watchfully waiting for you to develop the disease. But functional medicine doctors don't do that. We actually can assess your iodine levels. We can assess your tyrosine levels in your body. And in most humans that I've tested in America today, we have significant iodine deficiency. But I don't put people on big doses of iodine because that can also disrupt the nature of the manufacture of the thyroid hormones, and it can shut the thyroid down or speed it up way too much. So what I suggest for most people is many people have moved over to using sea salt because it's a broad-based salt. And sea salt has no iodine in it, and neither does regular table salt. You have to get iodized salt. either way. So I recommend people using sea salt to get iodized sea salt. A couple companies make it. It's available at most of your stores. And that'll add iodine anytime you use salt. Plus, you can eat seaweed vegetables, like seaweed snacks. That'll add more iodine. But you also want to make sure you're getting enough protein to make the hormone, because we know that protein malnutrition stops the thyroid from functioning. So if you're a teetotaler and you don't eat enough protein, your thyroid's going to be slow.
Well, I also have low, I'm not sure if I'm pronouncing it right, ferritin, low, like protein
okay.
levels.
Yes.
And I believe it's because I wasn't eating any red meat, because I thought red meat was horrible, but then I...
You don't need red meat. You don't need red meat for protein. You really don't. You can have tofu, you can have eggs, you can have chicken, you can have fish, and you can eat grains that contain it too, and beans. So there's really lots of different ways to get it. But when you have low ferritin, it means you don't make enough protein from your liver, because you're not supplying your liver with enough protein substrates. You're not getting enough amino acids to make it. And so for a normal adult who has borderline thyroid function, I would suggest that you get at least a gram of protein per pound of body weight per day for a month or two, and then get your TSH rechecked and get a full thyroid panel. You deserve to have a free T4, a free T3, and a reverse T3 with thyroid antibodies, because thyroid antibodies can also disrupt the function of thyroid, to see where your thyroid function has gone. And I think that's really an important way to look at it. Add iodine, add protein, and add exercise, and then see what your numbers look like. And I bet you don't need thyroid hormone.
Well, I've increased my exercise, and I do take 150 mgs of kelp a day. So I believe if my iodine was...
Do you take 150 milligrams of kelp iodine or 150 milligrams of kelp?
Kelp.
Okay. Well, there's virtually no iodine in 150 milligrams of kelp. You need to eat like a little box of the seaweed snacks to get enough iodine in.
So there's no iodine?
In 150 milligrams, there may be a microgram or two of iodine. You're not going to get a lot of iodine, I think, in that 150 milligrams of kelp, because kelp has proteins and fiber and other things in it, not just iodine.
Well, with allergic reactions to shellfish and things like that, I was trying to find an alternative.
Okay.
Seaweed.
So you're eating kelp right now?
Yes, and I am monitoring my protein levels, and I do make sure I get my protein levels up. But at the same time, the doctor suggested that I start 25 milligrams of the, you said it's a T4 drug?
Yeah, levothyroxine. So that is an option. I mean, many doctors jump right to it, but the Harvard endocrinologist that was in the last thyroid lecture that I went to said, if a person has a 5 to a 10, you may want to tell them to do some lifestyle changes and recheck that in 2 months, because why would you want to commit somebody to an exogenous hormone before you find out if their body can make it better?
That's what I'm confident that I can probably get off of this drug. That's why I'm trying to figure out what can I do.
My experience is once somebody goes on a thyroid drug, they never get off of it. So if you want to consider looking at what you're doing, you might want to try and do it without a drug before you do the drug, because what you've got is not a disease. You've got a little sign on one lab test that said, there might be an issue here, and it's not even a thyroid hormone that is abnormal. It's a pituitary hormone that's not your thyroid. Is it worth it to treat the thyroid with an ancillary test of a pituitary hormone? I don't think so. In fact, Harvard told me don't do that.
Well, with the low protein, blood protein, could that be the what's causing the thyroid problems?
As I just said, Protein is absolutely important to making thyroid hormone. If you don't get enough, you don't make the hormone, and then it looks like you have hypothyroidism. So the first things first, you add iodine and you add protein. And once you've done that for a couple months, you check the thyroid again and see if you check the pituitary again, because that's what your doctor's going to check. They're going to check a TSH. If your TSH went down, great. You've actually licked the problem. If it went up, then you need further evidence and not just a TSH.
So if I've started this drug, you're saying that people cannot get off of it?
No, once you get on it, doctors won't take you off of it because they think you have hypothyroidism and they will never stop it. I'm one of the few doctors on the planet that will say, let's get rid of your thyroid hormone. And so if you don't want to be committed to a medicine you don't need, I wouldn't start it. I'd do the natural stuff first and see if you can jumpstart the thyroid, because Harvard endocrinologists suggest that you don't treat a TSH of 5 without doing something other than treating it with thyroid medication the first time you see it. I'm just reflecting what Harvard says. Don't take the pill. Try something different, because you're not a puddle of mush. Like, people who have real hypothyroidism can't get out of a chair. They gain 20 pounds. They have edema. They're tired. You have a bare finding on a laboratory. Do you want to be treated as a laboratory number, or do you want to be treated as a human?
A human.
Good. Then think about what I just said and take that to the doctor and say, hey, why are we trying to treat this without trying to treat it first with normal human behavior?
Now,
good luck with that. Thank you for bringing that question to me. I think it's an excellent one, and I think a lot of people got some education today. Have a great week, and good luck with your doctor.
Okay. Thank you.
Thank you there, Roselle. Appreciate it very much. And let's go to Mike in Sarasota. We're down to about the last 7 or 8 minutes. Good morning, Mike.
Hey, thank you for taking my call. I've got two things to add. One's a comment. I called maybe 3 or 4 weeks ago and mentioned my problems with getting stevia without some sort of artificial sweetener in it. I mentioned that on Publix and Whole Foods and could not get it. And you recommended that of the sweeteners available, that allulose was good, and you also recommended monk fruit. And so, just a little update on that. I went back to Publix and to Whole Foods, and they had no sweeteners, no stevia with allulose, or what you might call a benign other type of sweetener. They all had erythritol or dextrose or something like that. So
that's correct. You're going to have to find it online.
Well, what I did, I was able to find monk fruit. They do sell monk fruit with allulose. They do. And I'm trying the monk fruit with allulose. I noticed that it's a lot weaker than stevia. I mean, something like 2 tablespoons of monk fruit with allulose is the equivalent of maybe half a teaspoon of stevia. So I'll work around that. But I do want to thank you for giving me that advice, and do want to point out that it's hard to get stevia locally without these, maybe non-benign other sweeteners in there. The
only one I know of is the liquid stevia drops. If they still have them on the shelf, it's called Sweet Leaf. They didn't put any extras in there.
Okay, that's good. Now, I do have a question for you, and I'm just following up on a comment you made maybe 20 minutes ago.
Yes.
You told one of the callers that to try oatmeal, that helps reduce cholesterol. And so I've got an ongoing debate. I have a doctor, and as soon as I turned 65, he wanted to put me on statins. He said he just does that regardless. Even if I didn't have a cholesterol problem, he does that. So I refused to do it. Since then, he has pointed out that I should be very careful of the various sort of non-dairy milks, the nut milks and other things, because they might raise cholesterol. So my question for you is, and I've been wondering about this, does oat milk tend to raise cholesterol? I mean, or almond, and taking a look at the other milks too. You got almond milk and maybe rice milk as well to consider. Which are any of those, say, bad for raising the LDL or good? Or do you have any recommendations on that?
Well, I think that soy milk has a long track record of being very helpful for cardiovascular health and also for hormonal health. And so if you do some organic, non-sweetened soy milk, you can get it in the dairy case next to the milk, or you can get it in vac packs on the shelf. they do not raise cholesterol in general. Soy milk has the strongest evidence. A 2024 analysis of 17 randomized controlled trials showed that replacing 500 milliliters or 2 cups of cow's milk with soy milk reduced cholesterol by 7 milligrams per deciliter. Just that change dropped at 7 grams per deciliter. And so oat milk may also slightly reduce it, but I think oat has a better track record of eating it. And the only one to consider possibly as a problem is coconut milk, because it has saturated fats. But and so if you do a lot of coconut milk, you might elevate your LDL. But the real key here is for you, since somebody wants to throw you on a statin, is to know what your cholesterol level is.
Right. And my cholesterol level, I mean, the last time I went to him, the LDL was at 105, and he was saying, this is bad, but
it's not bad unless you have cardiovascular disease. I would consider a cheap coronary artery calcium score just to see what you got there. If you have coronary artery disease, it's probably worth it to get on a lipid lowering protocol that may include a statin.
Okay. Well, I don't have such problems, and one of the things I remember is that years ago they used to be worried about cholesterol levels like in the 300 range or the 270.
Yes, but have you had a coronary artery calcium score to see if you have coronary disease?
Yeah, right. And I don't have that at all. Right.
Oh, you did? You had your coronary score?
Well, no, I haven't had a coronary score, but I don't have any coronary disease at all.
How do you know that? How do you know that you have no coronary disease without actually doing a test to find out?
Okay, I guess maybe I should. Okay, I just say I'm not suffering any symptoms of
right, but and many people don't until they have the heart attack. So what I'm suggesting is your doctor wants you on a statin. Your LDL is not really at a level that's all that bad, but it may be worth it to get a coronary calcium score because they're relatively inexpensive at this point, and you might find some really good information.
Okay, you said a coronary. What was the second word? Calcium? Did you say?
Coronary calcium score. Yeah, every cardiologist and primary care doctor knows about this one now.
Okay, and what is that? Is that they draw your blood or something like that, or how do they do that?
It's a CAT scan. So.
It's a CAT scan. Okay, all right.
Yeah,
okay.
Go talk to your doctor and then let us know what you find there. All right.
One more follow-up question. You recommended soy milk. I guess you don't feel like soy raises estrogen levels in males or anything like that. I've heard that before. So.
Yeah, there's a lot of people putting hokey crap on the waves, and that has absolutely no connection to reality. So I wish everybody would just stop thinking about soy as something negative for hormones. It is actually positive. It actually works like tamoxifen, the treatment for breast cancer. It blocks the signal of estrogen on the prostate and the breast. So it's a really beneficial tool.
Okay, great. One last question, and I'll get off the phone. I don't want to hog the airwaves. I completely get what you're saying about coconut milk because that's got a lot of coconut oil. It's related to coconut oil, perhaps. And I was thinking that like almond milk might be kind of fatty and oily too.
Almond milk has absolutely no effect on the lipids, from what we can see. But there's very limited data on these things at this point. They're working on it. So thank you for your input. Great questions, and good luck with this.
Thank you very much. Have a good morning.
You too. Well, I think I'm going to answer no more questions today because we're really down to the wire. Really, it's been a great day. Thank you for all your questions, and I really thank Bill for running the boards. Who's on the phones today, Bill?
We've got Maddie doing the phones for us, and bless her heart. Thank you, Maddie.
And hey, I wanted to mention to everybody that I have just put on my website, Functional Medicine Florida, an assessment for toxicity and inflammation. It's an interactive questionnaire. You go online, you fill it out, and you get data about where you are in the spectrum of toxiflammation, whether you have symptoms that indicate your body's on fire or sick from toxins. And it's really exciting me to be able to give everyone this tool to understand where they are in this world of really nuanced healthcare and health conditions. So Functional Medicine Florida, look for this toxiflammation assessment. Thanks a lot and have a great week. See you next week.
And thank you, Dr. Harvey, for another informative and rewarding Healthy Steps radio show. And thanks to all of our participants, listeners, and supporters. You make this show exemplary. You have been listening to the Healthy Steps radio show with Dr. Fred Harvey here on WMNF Tampa. Waiting for you like a dear friend is 5 minutes of NPR headline news, and then get ready for the Sustainable Living Show, hosted today by Annie Ellis. So until next Monday at 10 a.m., thank you for supporting and listening to the Healthy Steps radio show with Dr. Fred Harvey here on WMNF Tampa, your community-conscious radio station. Stay safe, stay thoughtful, and know that you are loved.